When it comes to the coronavirus, there's a lot of misinformation on the internet, especially on social media. Now, advocates want to hold social media companies accountable for the negative impact that misinformation is having, especially on African Americans. A poll by the Center for Countering Digital Hate shows social media companies are not doing enough to protect African Americans, specifically because of medical misinformation left on their platforms. The group says African Americans are more likely to go to social media for coronavirus news versus conventional media. The study also finds those relying more on social media for information are less likely to trust scientists and would refuse the coronavirus vaccine. Imran Ahmed joins me now from London. He is the CEO of the Center for Countering Digital Hate. Imran, thank you so much for joining us. So Facebook, Twitter, Instagram, and YouTube have all claimed they will be taking a tougher stance on the spread of misinformation. But advocates say those companies are failing to remove medical misinformation from their platforms. So can you give us some specific examples of the kind of misinformation they're talking about and how much is not being taken down?
Of course. The study that we did looked at, we did both polling, but we also did a study of 1,000 bits of misinformation, which we recorded on those platforms and we reported to the platforms, and we invited them to take it down anonymously. And we found that less than 5% was taken down. And what sort of misinformation? Well, things like vaccines cause autism or cancer, that COVID isn't real. Nonsensical stuff like Bill Gates is trying to microchip the population. But all in all, that misinformation is flowing unabated because nothing is being done, even when we highlight it to them.
So you guys are keeping close tabs. Tell us which social media company seems to be doing the most to combat these false narratives and which one seems to be doing the least.
Well, when overall it's less than 5%, no one in 20 bits of misinformation that's being taken down. No one's really doing a great job, let's be frank. We were very surprised that YouTube in particular took down not a single one of the 40-odd videos that we flagged to them. However, when we published our report this morning, they immediately took down those videos that were featured in our report specifically. And why was that? They're admitting two things. First of all, that the content in there was dangerous medical misinformation, but second, that they'd failed to act in the first instance. It's so sad that the only time they do act is when they're forced to do so through the pressure of public exposure.
That is very interesting and very telling. How big of an impact is social media having in African American communities when it comes to getting medical information?
Look, there is a slightly higher usage of social media rather than traditional media to gain information about coronavirus by African American populations and Hispanic populations in the US. The same holds true in the UK as well. And we see as well there's slightly higher trust levels. So they're more likely to respond to our survey, which was conducted by YouGov of 4,000 American adults, saying that they trust the information they get on social media. And that indicates that it's very urgent that we inform people that the information they see on social media can be manipulated by anyone, whether it's a scammer who's trying to make some money out of selling a false cure, or it's a hate actor who's trying to make people doubt the government, or who knows, it could be a foreign agent, it could be anyone.
Mm-hmm. And it's interesting, all of the things that the failure to act report is revealing, you know, such as it's having a wider reach than just the African American community. Polling done by the CCDH found in the African American community, 58% of responders were hesitant to get a vaccine if one were available, while in the Hispanic community, 52% expressed hesitation. Why do you believe that we are seeing such a lack of trust for a potential vaccine in these communities of color? And what efforts are you possibly taking to change this misconception?
Well, look, there are historic reasons why African Americans may doubt the honesty and the good intentions of the medical community. You don't have to look back that far to find the Tuskegee experiments, but also a history of medical malpractice and maltreatment. But right now, this is a vaccine that's been produced by the world's scientists. This is a global effort to deal with a global disease that threatens all of our lives. And we will need people to do their best, to do their bit, as we all have, staying at home, socially distancing, trying to make sure that we abide by the scientific recommendations. The vaccine will be a necessary part of that battle to contain coronavirus, because otherwise, as we see, hundreds of thousands of people have died. And the disease, it cannot be contained. It will never, ever go away unless the vaccine is effective. So it's really important, first of all, that governments don't treat it as a political football, that it's treated with the reverence and the importance that it deserves. But second, that misinformation that's being spread online is stymied straight away. We need to stop misinformation flowing. The only people that can do that are the social media platforms themselves. And right now, our report documents very clearly their failure to act.
Well, Imran, Ahmed, thank you so much for calling attention to this colossal problem, and thank you for joining us today.
My pleasure.